I don't think any hyperbaric people likes you at this point.
Look, I think it's a fantastic technology.
But
I think if you're going to buy one, I always say that hyperbaric therapy is kind of my smokescreen. Absolutely. Strokes, traumatic brain injuries, mild cognitive impairment, even Alzheimer's dementia, surgical recovery, infection, chronic infection, longevity, regenerative medicine in combination with PRP, with stem cells, and the list goes on and on.
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 18 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Ayık Kafa podcast. On today's episode of Ayık Kafa podcast, I'm excited to talk to Dr. Scott Sherr all about hyperbaric oxygen therapy and how we can use it to maximize healing and reverse aging. Dr. Sherr is a board-certified internal medicine physician certified in hyperbaric oxygen therapies and health optimization medicine. He is the founder of integrative HBOT, a worldwide telemedicine practice where he consults and educates patients and clinics using his novel approach that includes cutting-edge and dynamic protocols. And now, let's dive into our conversation with Dr. Sherr. Here is something that is fascinating. A huge amount of people who watch this channel frequently are not subscribed. So I want to ask you a quick favor. When you subscribe, it helps us to make the show better, access to the world-leading experts, and ultimately bring you more value. All that I ask is for you to hit the subscribe button, and in return, I promise we will make Ayık Kafa better every day. So welcome, Dr. Scott Sherr, to Ayık Kafa Soberhead podcast.
It's great to be here. Thanks for having me.
Well, I've been looking forward for this conversation because it's been quite a time now that I was contemplating of purchasing a hyperbaric oxygen chamber. Mm-hmm. But there's so much information and so much positive and negative people are trying to convince you whether one way or the other way. I was very confused. And last year in December, I heard your conversation with Mark Hyman. And after that, I started following you and your work. Therefore, it's wonderful to have you. So I have two questions to start with. One is, what attracted you to hyperbaric oxygen therapy? The second one would be, what is hyperbaric oxygen therapy? Can we start like that?
Of course, yeah. So what attracted me to hyperbaric therapy was when I was actually in training in medical school back in Baltimore in the early 2000s. And when I was training, I was in this place called the Shock Trauma Center there. And shock and trauma are very common in this city in the United States, in Baltimore, Maryland. And actually a lot of people from around the world and all the various types of armed services actually go to Baltimore to get trained in shock and trauma. But in the basement, there's a large hyperbaric chamber there that they use for wounds, for burns, for chronic infections, for carbon monoxide poisoning, and lots of other sort of more severe kinds of things. And so I learned about hyperbaric therapy and the power of it in this trauma center. But my story starts even earlier than that because I grew up the son of a chiropractor, and I grew up very much out of the box as to what we thought medicine was. I didn't know what conventional medicine was until I went to medical school. But the idea for me was to go to medical school to try to have this high-minded goal of bridging this big gap between conventional and from the integrative world that I grew up in. And so, I went to medical school thinking I'd figure out a way to do this. And actually that way ended up being hyperbaric medicine, because when I learned about hyperbaric medicine in the shock trauma center where I was training, and this is like my third year of medical school. I mean, for those that are interested in medical training, what we were doing was, this is my third year of medical school. We were on call every 3 nights for 30 hours. So 30 hours straight every 3 nights. And so you'd work for 30 hours in the hospital at the trauma center, and then you'd go home and sleep for like 4 hours, and you'd have dinner, and then you'd go back to bed, and you wake up the next day, you go back to the hospital, and then you did this every 3 nights. I think it was for 4 weeks. It was pretty crazy. So I saw a lot of crazy things, and that's when I learned about hyperbaric medicine. It was this gigantic submarine looking chamber in the basement, and I saw people having these amazing recoveries with these terrible things, trauma-related, infectious-related, burns, carbon monoxide poisoning. And I got very interested in the technology, very interested in the physiology and what was happening inside the chamber to help these people that I thought were going to die, or if they weren't going to die, I thought they were going to be maimed and, lose limbs and get amputations and things like that. So, and that's when I kind of learned about the physiology of what hyperbaric therapy is. And I can just kind of go over that now, I guess. And so, but I guess before I get there, I learned about it in medical school. And then after I finished my training, I created an integrative practice where hyperbaric therapy was the focus. And over the last decade, it's evolved a lot. I was the medical director of a number of hyperbaric facilities in the Bay Area where I lived for many years. And then I created my own sort of online consulting integrative hyperbaric practice where I realized very soon after starting my hyperbaric work outside of training that hyperbaric therapy is a fantastic tool. It's a synergizer. It's an accelerator for healing. It has many, many implications and applications. But an integrative approach is really, really important, especially if you have more of a chronic issue that you're trying to solve as opposed to something more acute, where acute issues do very, very well, very quickly, oftentimes using hyperbaric therapy. More of a chronic issue or long-term goal takes more of an integrative approach, labs, supplements, technologies, practitioners, other types of surveillance to kind of really get the most out of hyperbaric therapy. I'll stop there first, and then I can answer the question about what hyperbaric medicine is, how it works, whenever you'd like. But I just want to make sure you don't have any questions.
No. I mean, that was a great start because while you were explaining and describing, you created this online consultancy. Just before coming to the studio, I was listening to something else that you were in. Mm-hmm. And I realized that it really, really, really is important that to have someone to guide you when to get in, when not to get in, what to do, what not to do. Because, then I thought of myself, oh my God, if I would buy that soft shell, anything can be negatively used. I don't know anyone else if they know how to guide you when you purchase something. You just buy it and God forbid, you may be using it in a very wrong way. And I'm going to also tell you why I stopped buying, and maybe in the future I may consider again buying. I'm sure you know of this machine, Nanovi.
Mm-hmm. Yeah, I know it.
I have one at home. And the owner and the inventor, let's say, Hans, I guess, if I'm not mistaken the name, when I saw him at A4M again, and I was like, I'm planning to buy one. And he goes like, why? That was a great question, actually. Nobody asked me before when I was buying something. I said, let me think about it. Why? Yeah. I don't know, because they say it's good. And he goes like, so what is your purpose? You're not an athlete. I don't think you get injured quite often. And it's not a good thing to push in this oxidative stress constantly if you don't have something else to heal after, to balance. And that scared me, actually. That made me think, really, would I need or not?
Yeah. Good question. I mean, good comments. And I think what I often say to people, it's not if hyperbaric therapy can be helpful, it's actually when. Because I do think that everybody can benefit from going into a chamber at some point. It just depends on what their goals are and why they're doing it. If it's the right time now, or if it's a time later on when something else is happening. And I've gotten into trouble in the hyperbaric community because I don't own a facility. Okay. I don't have stock in some facility being full of patients to get people in there and get into the chambers, right? So my philosophy has always been, if there's an acute issue, if there's an acute trauma, ischemia, inflammation, stress, hyperbaric therapy can be fantastic to help you heal faster. And we can talk about why. Mm-hmm. Of course, you want to make sure that you're being assessed by a medical provider if it's a very serious kind of thing, like a stroke or traumatic brain injury or a severe trauma, et cetera, like go to the hospital, right? Get checked out. But hyperbaric therapy can be a fantastic way to heal the body and the brain much faster, oftentimes, than the body and the brain can do on its own. And so it's not as controversial for me to have somebody come in for like an acute issue, but it's more controversial if somebody has a long-term issue. They have a long-term chronic issue that's been going on for months to years to decades at some point. And then they say, well, I just want to get into a hyperbaric chamber. And that's not always the right plan. Oftentimes it's more of an integrative one that's really important. Like, what have they been doing for their diet, their lifestyle, their behaviors? Have they looked at optimizing their laboratory values? Like, what's going on in the system? Because what you just mentioned earlier about oxidative stress is extremely important, right? So what hyperbaric therapy really is doing, in essence, and we can talk about the definition here in a minute, but in essence, what it's doing is it's increasing the amount of oxygen in circulation, okay? And it also increases the amount of pressure that the body is under to create all this oxygen that gets into circulation. But when you have all that oxygen in circulation, what happens is that you make more energy because oxygen is required for you to make energy, but you also create what you just described as extra products of energy metabolism called reactive oxygen species. And as a result of that, you get more of this oxidative stress in the system. Now, that's actually one of the major ways that hyperbaric therapy works, by creating this oxidative stress. And then as a result of that, you have all these physiologic changes that happen that are called epigenetics, where you have this shift in how your genes are being transcribed, the genes that are responsible for growth and for decreasing inflammation and preventing cells from dying. All of those things get upregulated with this oxidative stress. Also, stem cells get released from your bone marrow as well and from other areas. So these stem cells can go to areas to help with healing. But you have to be able to neutralize or balance out that oxidative load of being in a hyperbaric chamber. And the deeper you go in a chamber, the more of that oxidative stress that you're going to create. And so if you don't have the capacity to balance out that oxidative stress, you're not going to feel very good, because your body's going to be under stress as a result of having that, that extra oxidative stimulus in the system, and then you're going to have that inability to neutralize it, so you're going to feel like crap. So, it's not uncommon for people when they first started hyperbaric therapy, even if they're relatively well optimized, to feel kind of iffy for like the first 2 or 3 days of starting. But after that, it typically does get better if you're relatively balanced in your antioxidant capacity with this oxidative load that's coming in. So, long story short is that, again, it's not if hyperbaric therapy will be helpful, it is when. And if it's more of an acute issue, it's going to help almost across the board, as long as you're safe to get into a chamber. And from a chronic perspective, there's more variability if you don't do some of the foundational things first, or at least at the same time or concomitantly as you are doing hyperbaric therapy to see the maximum benefit.
So maybe now it's time to explain to the audience what is hyperbaric oxygen therapy and how it started.
Yeah, so hyperbaric therapy has been around a long time, in various ways. The technology of understanding what happens when you put more air into a pressurized chamber and take more air out of a pressurized chamber has been around since the late 1600s, actually. Oh. But people didn't really understand what was happening inside of these kind of compartments that they were developing until the late 1800s, early 1900s overall, because hyperbaric therapy, as it's kind of now has been evolved into, started off as a treatment for decompression illness or diving injury. And this is something that historically was described in the late 1800s and building many bridges, like the Brooklyn Bridge in New York, where you were a resident for a while. And the Brooklyn Bridge, what was actually happening is that people were actually building the bridge, were getting these severe injuries when they were underneath the water, building out the pylons, or so that the bridge parts would be going underneath the water. And they described it as the bends because people would be bent over when they came on, because they would get these really severe neurologic injuries. Some people would die, paralysis. In fact, the architect of the Brooklyn Bridge was paralyzed due to decompression illness. And it wasn't really understood until that time what was happening with nitrogen, specifically when people would be too far, be underneath the water, come up too fast, and things would kind of bubble out, like your nitrogen, which is in the system, would bubble out and cause these blockages of blood flow. But if you went back into these kinds of underground locations where they were building out the bridge, the symptoms would go away. So if you didn't die, of course, you can go back into the next day and your symptoms would get better. So modern hyperbaric therapy was developed to treat the bends specifically by simulating the pressure that these divers or these builders would be under when they were actually working on the bridge itself. And it wasn't until the 1920s and 30s where this was actually happening more commonly. But we now know that there's two things that are happening inside a hyperbaric chamber. One is that we're increasing the amount of oxygen that you breathe, increasing inspired oxygen. And the second is that we're increasing atmospheric pressure. We were just describing the pressure just a minute ago, right? But I think it's easy to go more systematically here. Mm-hmm. So when you're talking about oxygen, most of us know that oxygen is really important for us to be alive. Without oxygen, we don't live for very long because oxygen is required for us to make energy. So typically at sea level, there are 21% oxygen in the air. The rest of that is nitrogen. That's why it's actually important in diving and diving injury actually. But most of it's nitrogen. And so But this 21% of oxygen that we get is able to maintain all of our physiologic functions. So if you check your pulse oximeter, like an oxygen meter, that's going to measure somewhere between 97 and 100%, because what that's measuring is our red blood cell saturation of oxygen. So red blood cells are the types of cells in our body that carry oxygen from our lungs to the rest of our body for all the physiologic needs we need oxygen for. And so typically we have a certain amount of oxygen carrying capacity, meaning how much oxygen we can actually carry, which is dependent on how many red blood cells we have in circulation. So how can you increase the number of red blood cells in circulation? Increasing your oxygen carrying capacity. Well, you can come visit me, or as there will be next in a little while, you're going to be coming to Colorado. You're going to be training at altitude. If you're training at altitude, you're going to increase a hormone in your kidneys called EPogen, which increases the number of red blood cells that will be increasing in circulation. You can also take EPO as a drug. It's been used as a doping drug. It's like the doping drug for cyclists and other endurance runners for forever, because it increases red blood cell number. You also can give yourself a transfusion. You can actually transfuse yourself, pack red blood cells before doing a race, and that's going to increase your oxygen carrying capacity too, because you have more red blood cells in circulation. But there's another way to increase the amount of oxygen in circulation, and that's by saturating the plasma, or the liquid of our bloodstream, with more oxygen. And the liquid of our bloodstream is kind of like the water of our bloodstream. It's not the red blood cells. It's just kind of like saline kind of thing. If anybody knows what saline is, it's like kind of like a salt solution. Mm-hmm. But that has very little oxygen in it at sea level. But if we pressurize those blood vessels, you can get a lot more oxygen into that liquid itself, because pressure itself changes how our physiology works by physics. It's a physics law called Henry's law, which just basically states that the more pressure you put on a gas, the more of that gas that's going to go into liquid form. So in this case, if you increase the amount of oxygen that you're breathing, say from 21% to 100%, and then you're increasing the pressure to a certain amount, the more pressure that you put on the lungs in this case, the more of that pressure is going to shift that gaseous oxygen to a liquid oxygen. So you can get, at 33 feet of seawater, you can get 2,000% more oxygen in circulation, or, which is a huge amount of oxygen compared to what you can at sea level. And so the deeper you go underwater, for example, so we were talking about bridges and water, right? So water is extremely heavy. And so if you pick up a bucket of water, we all know that water is very heavy. So if you're 33 feet below the sea, all that water above you is exerting a pressure on your body. And then it's that pressure that we simulate in a hyperbaric chamber. And it's that pressure.
Oh, I never thought of that. So when you're in the water, you don't feel it, but all this quantity above you makes a pressure?
Yes, it does. And so that pressure we don't feel when we're underwater, because, we're weightless, and the density of water itself. I mean, obviously people know, there was just in the news, right, about this submarine thing that, crushed when it was trying to go to the Titanic. That's all because of the pressure of the water itself. And so we can simulate the pressure. We don't go that deep. Typically, our pressure ranges anywhere between about 15 feet of seawater to about 45 feet of seawater under most circumstances. Sometimes we'll go down to 66 feet of seawater, but that's pretty rare. But the cool thing about 66 feet of seawater, which is also in our terminology called 3 ATA. So ATA is what we use. 2 ATA is 33 feet, 3 ATA to 66.
So where we're starting is 1, correct? When you get into the chamber and there's nothing in it, it's the 1.
You start off at 0 feet of seawater, but that's also called 1 ATA. Yes, yeah. And then you go to 10 meters, and then that is 33 feet of seawater. That's 2 ATA. And then there's 66 feet of seawater, which is 3 ATA. So the cool thing about 3 ATA is that at that level of pressure with 100% oxygen, you can saturate so much oxygen into the liquid of the bloodstream that you no longer need red blood cells to maintain physiologic function. So they've done this clinically. So they use hyperbaric therapy for patients that are Jehovah's Witness, so patients that do not or refuse blood transfusion in the United States and other places around the world. And they also use it for acute blood loss from a trauma to kind of temporize somebody while they're, resuscitating them as well. But so that's just the power of how much oxygen that you can get in the circulation. And then as a result of all that oxygen in circulation, as a result of all that pressure, you get an immediate improvement in oxygenation. Of course, you get an immediate improvement in decreasing inflammation. You have an immediate improvement in stem cell release as well, and you have an immediate increase in decreasing inflammation, decreasing swelling as well. So you get these immediate effects that are very, very beneficial. And then over a longer protocol of hyperbaric therapy, you start shifting that epigenetic expression of various genes that helps overall with healing and optimization.
So were you explaining the 3-ATA or all of them?
So they all work in a spectrum. So in the sense that the lower pressure, like the milder pressures, like the 15 to 33 feet of seawater, or like 1.3 to 2.0 is more focused. Those pressures are typically better for the brain overall. And as you get deeper, it's more systemic. So between like 1.3 and 2.0 is typically where we treat the brain and spinal cord, and like 1.7 to 1.8 to 2.4 is where we treat like the rest of the body overall. But there's obviously an overlap there where sometimes we go deeper for the brain up to 2.0. It kind of depends. But as you go deeper, you are going to get more stem cells released. As you go deeper, you're going to get more oxygen in circulation. This is all true, but the question just becomes then, what's the optimal amount of pressure and oxygen for a certain type of tissue that you're looking to address?
So when you said about altitude and you're in Boulder, Colorado, this machine CVAC came to my mind. It's a mouthful,
cyclic variable adaptive conditioning, I think is the name.
Yeah, cyclic variation in adaptive conditioning.
It's close.
Yeah. No, I took a note over here. So obviously they're different, but somehow my understanding in certain performance capacity, it's kind of similar a bit.
So CVAC is different because it's simulating altitude. Instead of in a hyperbaric chamber, we're simulating going underneath the sea. CVAC is simulating you go to a mountain. But what CVAC does, what is also very interesting is that it changes your altitude very, very quickly. Whereas in a hyperbaric chamber, we are simulating a pressure you feel under a certain amount of seawater, and you're maintaining that pressure for a period of time, typically 60 minutes, 90 minutes, sometimes 2 hours, depending on the situation. The main similarity is that there is a pressure change, but the pressure change is in sort of the opposite direction because we're going down as opposed to CVAC going up. But it's more like CVAC's going like up, down, whereas hyperbaric therapy is going down and then it's going up kind of deal. So that's the way I'd like to describe it. But there could be similar physiologic effects with the variations in pressure, whether you go up, whether you go into like a high altitude or a low altitude, interestingly, because you are varying the pressure and varying oxygen levels does have a similar effect, whether you're at altitude and coming down or whether you're at a hyperbaric chamber and getting pressurized. It's a little confusing, but the way I would describe it is this. Okay. So if you're in a hyperbaric chamber and you're at, let's say, 2 atmospheres of pressure, which are 33 feet of seawater, and you're breathing oxygen. Say you're breathing 100% oxygen. And then what we do is at this pressure, we give you what's called an air brake. We have you breathing this 100% oxygen.
Actually, I was going to ask because I did, and then I got bored. Like I did 5 or 6 times in the 2 ATA for 90 minutes. I mean, even getting out takes 10 minutes because the pressure has to like go down slowly, not to shock you, I guess. So there were the 20 minutes wearing the mask, 5 minutes off, 20 minutes. It's like pulsing. I think you were talking about that.
Exactly. Yeah, it's called an air brake. And so what that means, so you're starting off, you have 100% oxygen on, and you take a break of that 100% oxygen. You go back to 21% oxygen breathing for a period of about 5 minutes. And you're staying at the same pressure, but what you're doing is modulating the oxygen. And when you do that, that relative low oxygen, so you're going from 100% to 21, even 21%, even though that's sea level amounts of oxygen, your body sees that as a hypoxic stress, as going to a low oxygen environment, even though you're going back to normal oxygen. And so as a result of that, you get like a number of different benefits of this relative hypoxia. And this is called the hyperoxic-hypoxic paradox, or HHP. And as a result of that, you get some of these hypoxic factors that get released, one called hypoxic inducible factor, which increases the number of blood vessels that you can make. It decreases inflammation. It increases stem cell release. And so we think that it's a very, very beneficial aspect of the therapeutic nature of being in a hyperbaric chamber. And it also prevents something called oxygen toxicity as well, especially at the deeper pressure chambers. So if you're going to 2 atmospheres, 2.4, 3.0, like these give you a higher risk of the oxidative stress causing an issue. And so you can use these air brakes mitigate that, to decrease the risk of having, oxygen toxicity, which is rare, but does happen. But it's also got a therapeutic benefit because it increases stem cells, blood vessels, decreasing inflammation at the same time as you're doing your protocols. It could be very beneficial. So the reason why I mention that in the context of CVAC is that CVAC's causing these relative hypoxic events too, because it's changing altitude very, very quickly. So it has this same induction of these hypoxic factors, the one that I just mentioned. But the difference with hyperbaric therapy is that you also get more of the healing that you can get very quickly in a hyperbaric chamber because you're getting more oxygen in circulation, as opposed to CVAC where you get less oxygen overall, which can be beneficial, but it's not going to have the acute healing effects as, going into a hyperbaric chamber.
I know that there's one Israeli study for longevity.
Yes.
I think there's only one. I don't know if there are others.
Well,
the reason I want to start this longevity conversation nowadays, everybody looks for ways to how am I going to live longer or healthier, whichever is more relevant for them. And obviously all these machines, gadgets, they all promise a lot of things. Like, if you do this, you're going to live forever. If you do the other thing, it's going to be so beneficial.
Right.
And I was looking in the published articles. So I found this one study, 90 days.
60 days.
60 days or 60 session?
60 sessions, 60 days. So 5 days a week, Monday through Friday for 3 months. Yeah.
How relevant it is? Or, because it's like a very strict protocol.
Yeah.
As I was saying, I could only stand by like 6 days and I'm like, okay, I can't do this anymore because you're stuck. You have life going on out there and you're like, oh my God, I don't know what to do with myself.
So, the way hyperbaric therapy works is that for more of an acute issue, as we've been describing earlier, you don't need that much hyperbaric therapy to see a fantastic benefit very, very quickly. I used to, and I still do work with patients that get plastic surgery or knee replacements or hips or anything you can imagine that has more of an acute thing like that. You can see benefits in like 2 to 3 sessions. I have patients that are athletes that use it for muscle recovery. They use it for exercise recovery. Just a couple sessions can go a long way. But if you have a chronic issue, or you have a longevity goal in this case, you're looking at shifting epigenetics, right? You're looking at shifting how your genes are transcribing various genes. You're looking at decreasing inflammation and making those stem cells release as much as possible and trying to help the whole system revitalize with new blood vessels as well. So that takes time. And the minimum that we've seen major shifts in some more of these like longer term markers are about 20 hyperbaric sessions, which is usually done Monday through Friday, 5 days a week for that 4-week time. Now, the Israeli study used a 60-day trial, so 3 months of hyperbaric therapy, okay? And they did this in succession, though. It is a huge commitment for people to do, no doubt about it. But what the study did show is that there were some benefits in senescent cell populations, so with decreasing in these zombie cells that get more prevalent as we get older. These are cells that are in our body that don't divide anymore. They can cause inflammation. They're associated with cancer and degeneration, et cetera. So it was around treatment 30 that they saw the maximum number of senescent cells go down. Also, they saw telomere length go up as well, which again, there's some controversy on telomeres themselves, but as a longevity marker, but that was one they used. But what's interesting about this study, though, as they used the same study population to look at a whole number of other markers too. So they looked at angiogenesis or new blood vessel growth in the brain, significantly improved after these 60 sessions. Erectile function in men, significantly improved after 60 sessions. Cardiac function, significantly improved after these 60 sessions. But the cool thing is that, we're not just looking at hyperbaric therapy in a vacuum, which is what they did, right? They didn't do any other interventions except for hyperbaric therapy. So in my estimation is that you can vastly decrease the number of sessions you need to do to see that kind of benefit if you're using more of a integrative perspective. If you're looking at optimizing your laboratory data, optimizing your diet, your lifestyle, your behaviors around all of that, other aspects of your health, like other technologies that you might want to use, other practitioners that you might need to help you. So if you're doing a more of a holistic approach, we can get that down to a minimum of between 20 and 30 sessions for somebody that's being well optimized otherwise. But still, it's going to be commitment, right? You have to really see that shift in that epigenetics, and you want to not only shift them, but you want to get the stability of that shift. So that's usually somewhere between 20 and 30 sessions. For somebody that's relatively well optimized, it could be very optimized, it could be 20. For somebody that's relatively well optimized, it could be 30. It just depends on the person. But It is a commitment if you're looking for more long-term
20 is
benefits.
much different than 60, believe me.
Yes, yes.
20
But if you're
is doable.
if you're supplementing well, the way I think about it is that you can maximize your ability to benefit from being in a hyperbaric chamber. Like, what are you doing before? What are you doing after? And maybe what are you even doing during your hyperbaric session, right?
Actually, you were saying something like that. Let's come to that, because you said it has to be some prep or some pre-work to be done in order to get the full benefit of the chamber.
Yeah.
And after, because does it even stay? Like, let's say 60 days is over or 90 days is over, and how long these telomere stays longer, or does it like rush back to get short again?
So nobody knows, right? Nobody's looked at how long the telomeres stay long or how long you're going to have senescent cell populations decrease. But the key of all of this stuff is that if you're doing the same stuff that caused you to be in the situation that you were in, whatever that situation might be, if you're still doing all that same stuff, if you're still drinking alcohol 3 times a week, if you're not sleeping very well, if you have poor relationships, if you are on medications that are affecting your mitochondria, or, the list goes on and on. Do you have insulin resistance? Like, the chances are that whatever benefits that you saw are going to degrade back over time. So it's a great model, just like Ozempic, right? Like, everybody has to take Ozempic for the rest of their life if they take it now and lose weight, because if they come off your GLP-1s, it's very difficult to keep your weight off. It's the same thing with hyperbaric therapy in this context. It's like, yeah, I could put you in a chamber. You're going to feel better regardless after doing 40 sessions a lot of the times. But how long is that going to last for you? Maybe not very long at all, because you didn't do anything else to really try to work on those foundational markers, the foundational aspects of your biology that would really benefit you, not only if you ever went into a chamber, but for the long term, right? And so I always say that hyperbaric therapy is kind of my smokescreen for health, because if somebody like, hey, Dr. Scott, I really want to get into a chamber, I have migraines or something like that, right? I'm like, okay, great. Well, hyperbaric therapy could help, but what about all these other things that you could do to optimize so that you don't have migraines otherwise? And then we can get you into a chamber if it still makes sense, or for more longevity reasons or whatever. So, 80% of what I talk about with people has nothing to do with hyperbaric therapy at all. Actually, it has to do with looking at foundational aspects of their biology and saying, okay, this is what we really need to focus on if you're really going to benefit the most from being in a chamber. And like, the number one area that I look at there is going to be the mitochondria itself, and how well the mitochondria themselves are working. Are they able to make energy? Are they able to detox from the energy that they make? Because if that's not the case, if I put somebody in a hyperbaric chamber and their mitochondria aren't able to do anything with the oxygen that we just increased to 2000%, and that's going to cause a ton of stress on the system and not see a benefit, or as much of a benefit as they could. So the key for me, if possible, is to have more testing in my patients and the people that I'm working with to know what that foundation looks like, support that foundation so that they can optimize their energy production and detoxification. And in addition, looking at how you can optimize blood flow to the tissues that you want to optimize blood flow to. So this could be with supplementation, this could be with other technologies, et cetera. But like, the key for me before somebody goes into the chamber is, can they make energy? Can they detox from the energy that they make? Can we get the oxygen in a hyperbaric chamber to the places where we want it to get to? And if we can't, how can we do that better? Do we need to use supplements? Do we need to use technology? Do we need to use other practices to be able to do that? And are they breathing correctly in general to be able to optimize their oxygen delivery? That's really important to me as well. So I think about all these sort of pre-hyperbaric things. And then, then after we've kind of worked on all that, then we can say, okay, now it's time. Like, you can do your longevity protocol. And instead of, 60 treatments, you don't need that. You need 20, you need 30 oftentimes to see that kind of benefit.
I have a question that is also concerning your company. Normally, I don't like to talk about people's product, but it's important because how you described what works mostly is the hard shells, mostly for the biggest thing. So I know you. I'm going to come to that. Don't worry. I saw your face. There are also a fair amount of soft chamber products out there, good ones, and you own one of them. I think you have the only one with a mask inside, I would assume, because the rest, I didn't see any pure oxygen coming in.
Other soft chamber companies, they do have masks as well. So I think that the key really to understand is that soft chambers usually are defined as chambers that go between about 1.3 atmospheres and maybe about 1.7 atmospheres, depending on the chamber. So it's better to think about it in pressures honestly, than it is to think about the type of chamber.
That's what I meant, because soft gels are not going to
they don't go as
strong.
deep.
Yeah. What's the purpose people purchase them and put at home? Are they sports people? Are they have something wrong with their brain?
So we know that these milder units, the milder pressures, like between 1.3 and 1.5, are good pressures for the brain overall, and then can be overall pretty good for overall, like for systemic kinds of things that are milder, like your jet lag, your exercise recovery. Is it better to have a deeper chamber to do some of this stuff? The answer is probably yes, but there is some pretty good data at 1.3 and 1.5, which are these milder pressure chamber pressures, right? But it's not going to be for everybody. And that's the important thing. The problem out there, Ezra, is that you have all these companies that sell only soft chambers that will say that you can go into a soft chamber, these milder pressures, the 1.3, 1.5, and you can get all the benefits of doing hyperbaric therapy at deeper pressures in a soft chamber. And that is absolutely not true, because again, the amount of oxygen in circulation that you can get at 1.3, at 1.5 is going to be vastly different than at 2.0. And even if you're breathing oxygen in a mask at 1.3 or 1.5, you might be getting about 300 to 500% more oxygen in circulation, which is not small amount. So that's a decent amount of oxygen, but it's not 2000% more oxygen that you get at 33 feet of seawater or 2 ATA. So there is a lot of misinformation. I hate that word, but there's
Believe
a lot of...
me, I know. I have a whole brochure sitting on my desk at home that's like giving all the promises with these 1.3,
Right.
1.4, 1.5 soft shells.
Right. And then that's one of the reasons why I got really frustrated back in like the late 2000 teen timeframe. And I was like, well, if I'm going to make a company here, like number one, I care about helping people primarily first, and we want to educate as to which chambers can be helpful for what. So for neurologic injuries, for neurocognitive kinds of things, 1.3 to 1.5 can be very, very beneficial. And it's actually nice to have a chamber at the house to use over the long term in this case, because if you have a neurologic injury, if you have lots of neurologic stress overall, like it's nice to be able to use a hyperbaric chamber regularly, not every day for the rest of your life, but periodically in a protocol, in an intentional sort of way, where you can use the chamber to bounce back from getting off an airplane, from bounce back from like a big cognitive week at work, bounce back from like a mild injury to your head. Like I have one at my house. My kids go in there if they get beat up, like, from playing sports or something like that, not from beat up from the street fighting or something, but they beat up playing sports. And I go in there.
How often you go in?
It depends on the situation, right? So
that was your signature line. It depends.
Yeah.
Not that I don't know.
Yeah, that's okay. For long-term use, I use hyperbaric therapy if people have them in their home or they have them available to them. I usually frame it where you are using it 5 days a week for periods of time, and then you're using it outside of that. You're using it periodically in a maintenance sort of way, maybe 2-3 times a week, maybe not at all sometimes, depending on what the situation is. So, but the reason for you have more intensive protocols when you're going in 5 days a week, but those are not as often as when you're doing more maintenance, when you're going in 2 or 3 days a week, for more of kind of a regular tune-up kind of deal, as opposed to going in more intensively. It really just depends on what the situation is as far as why you're using the chamber at the house. So, for me, like I use the chamber in my house. I have every year I'll do a 20 or 30 session protocol. And then after that, I'm using it periodically in maintenance when I can, when I have time, or when I need it, or when my kids need it, that kind of thing.
You do the protocol with the soft one?
Yep.
That you have, the low pressure? Okay.
Yeah. I do that with the soft one I have in my house.
So you think that it would do not maybe the exact same benefits, but close, depending on your situation, obviously.
Depending on the situation, but also I have a mild unit in my house, so I'm not expecting the full deep tissue benefit that I would get if I went to a hard shell unit and did that, right? So the Israeli studies, for example, that you were mentioning earlier, all use the 2.0 chamber. So if people ask me or ask my team, I'd like to use a 1.5 chamber, am I still going to get the benefits of my telomere length and my senescent cell populations? And the answer is, your favorite answer to my questions, we don't know, because nobody has done the research. So I can't tell you if it's going to enhance your ability to clear senescent cells or increase your telomere length? Nobody knows because the research hasn't been done. Now, will you get benefit there? Yeah, you'll get neurocognitive benefit. I have friends of mine that have chambers in places like in soft chambers, in places where there's no heart chambers available. And so people will use them and see benefit for some of these systemic kinds of things, even healing things like diabetic ulcers. I've seen in 1.5 chambers, which is something we would use 2.0 or 2.4 for. So you can still see benefit, but the benefit is not as significant in these mild units for more systemic things. So if you have like a chronic systemic inflammatory issue, you're going to benefit more likely at a deeper pressure than you would at a milder pressure. If you have an autoimmune issue, for example, you may not see any benefit at a 1.3. In fact, it may not be beneficial at all to go in there and really want to stick to a deeper pressure. So the key is to understand, again, why you're going in there. But in general, the milder units, the 1.3s, the 1.5s of the world, are good in my clinical experience for neurocognitive kinds of indications. So for brain healing, for brain optimization, and also for what I would call day-to-day operations. Things like jet lag, muscle recovery, a little bit of energy, like a little bit more focus, a good place to take a nap, like those kinds of places. So not for medical kinds of things outside of the central nervous system. Inside the central nervous system, for medical things, like for strokes and traumatic brain injuries and mild cognitive impairment, I've seen benefit at those milder pressures. But there's always caveats to these things. I like to think about the way I use hyperbaric therapy is dynamic. So I don't like to just stay at one pressure in people, especially if I don't see a benefit. So I may start off in somebody that has mild cognitive impairment at a 1.3 or 1.5 pressure. But if they don't see benefit after 20 or so sessions, then I want to go deeper if I can. But I often will start off at these milder pressures because they can be very beneficial to a lot of people, and they're safer overall to go to a milder pressure. There's less oxygen, there's less pressure, there's less things you need to worry about. So I think, and also in somebody's brain that's already compromised, that has mild cognitive impairment, that's had a stroke, that's had a traumatic brain injury, their brain is already under more oxidative stress, right? And so if you're giving them a lot more oxygen very quickly, you might see some detrimental effects before you see beneficial, if you see beneficial at all. And there's actually some studies that show this. There was a study that was done at the VA, the Veterans Administration of the United States, that had these patients with traumatic brain injury that gave them 2.4 atmospheres, which is a lot of pressure for the brain overall. And all these patients did worse for the first 3 or 4 weeks of the study. Eventually, their brains started to compensate. These are all young kids, like 20 to 30 years old. And so their brains were able to compensate, and they were able to have some improvement over the long term, actually, even at these deep pressures. But that just goes to show you that, too much oxygen and pressure for the brain is not a good thing as well. And so that's why there's, again, these spectrums. So I try to be as dynamic as I can for patients. I work with people all over the world, right? And I say, look, this is all you have available to you. If you just have a soft chamber that goes to 1.3 or 1.5, this is what you're going to potentially expect if you have a neurologic issue or if you have a systemic issue. Unlikely you're going to see a lot of benefit for the systemic issue. But if it's a neurologic issue, you maybe will. But if you have an option to go to 2.0 in your chamber or wherever you are, then you can say, okay, well, now let's start off at a milder pressure if it's a brain thing, but then we have the option to go higher or deeper in the chamber if we need to. And we can see that as a potential benefit as we're, again, hopefully supporting the person along the way, optimizing blood flow, optimizing energy metabolism, optimizing detox, using other types of technologies to help all of that stuff too, like your lights, your sauna, your other kinds of, technology that can help along the way, of course, as well.
So what do you think of EWOT,
Yes.
EWOT, exercise with oxygen therapy? Because kind of like you inhale 100% oxygen while you're doing some exercise without the pressure, obviously.
Without the pressure. I mean, you do get some increased pressure with that because of the intrathoracic pressure that you create when you do exercise. So there's increased cardiac output where your heart's beating faster and there's more blood flow that's coming out of the heart. I think there is some significant benefit to exercise with oxygen therapy. The challenge is that you have to have people that can exercise to be able to do it. And so not everybody can exercise, of course. But I have seen benefits. Like what you'll see these guys always talk about in the EWOT community is that it's better than hyperbaric therapy, or it's just like hyperbaric therapy. There's just no evidence that that's the case. There's evidence that you can get more oxygen delivery using exercise with increased oxygen, but there's really no evidence that you're getting anywhere near the amount of oxygen delivery that you can, at least in a deeper hyperbaric chamber overall. Now, can there be some equivalence maybe in the mild units? Possibly, right? But I think that there's a benefit there. And I use them in combination with some patients as well, depending on the situation overall. So I do think there's some benefits.
Who should not use the chambers? Mild or deep pressure?
Looking at hyperbaric therapy, the main two things are pressure and oxygen, right? So the things to think about are like, who can't get extra oxygen? And those are people that are already on oxygen already. So if you have a lung disease, you require oxygen. If you have severe asthma and you have a hard time with breathing already, these would be reasons that it may not be a good idea to get into a hyperbaric chamber unless it's under significant supervision overall. And if you're also putting the lungs under more pressure. So if you have like any other lung diseases that make your lungs more restrictive in some way, it also could be detrimental to go into the chamber. If you have any cardiac conditions where your heart does not get enough oxygen pumped out or get enough blood pumped out per beat basis, then that could be dangerous as well to put in a hyperbaric chamber, especially the deeper pressure that you go. This is called like an ejection fraction of the heart. Typically, if the ejection fraction of the heart is less than about 35%, typical is between 55 and 65. That's normal, is about how much blood flow gets ejected each time the heart beats. If it's below 35%, that can be dangerous in a hyperbaric chamber. If you have any uncontrolled heart rhythms, that's also could be potentially be dangerous. If you have a history of any seizure disorder that's not controlled, because what oxygen can do at high amounts is increase the amount of oxidative stress in the brain. And we were talking about this. And it can potentially cause seizures, but it's very, very rare for this to happen if it's mitigated with these air brakes that we were talking about earlier, along with if you have a seizure disorder, to make sure that seizure disorder is controlled before going into a hyperbaric chamber. You can also mitigate seizure risk actually by increasing your ketones, ketone esters before hyperbaric therapy. So in patients of mine with cancer in the brain specifically, we do use ketone esters that can decrease the risk of potentially having oxygen toxicity. A lot of my athletes will use it with ketone esters as well, just from like an inflammatory perspective. They feel great getting out of a chamber with some ketone esters around. So we'll use those as a prevention for oxygen-induced seizures related to oxidative stress. If you have a fever, you're not supposed to go into a chamber because that can increase your risk of having a seizure as well.
Oh, wow.
Oxidative stress again. If you're pregnant, you're not supposed to go into a chamber. Although in companies, in places like, I think Turkey, but definitely Russia, they use hyperbaric therapy more commonly, especially in carbon monoxide poisoning. Pregnant women can get into chambers and the babies are fine. But in general, we say, pregnant women shouldn't get into the chamber. If you're breastfeeding, you can use hyperbaric therapy, and we do have breastfeeding women that do use hyperbaric therapy. Hyperbaric therapy is also great for fertility because it increases blood flow and increases mitochondrial function. And so as a result of that, you can see benefits for fertility along with, many other, conditions along with longevity. The major other thing is claustrophobia. Like if you're claustrophobic, being in a chamber, enclosed area, that could be difficult for you. And then your ears, like if you're on a plane or a train, people feel that that pressure sensation. The same thing happens in a chamber. So if you have a hard time clearing your ears in a plane or a train, it might be hard to do that in a chamber. That's something that could be difficult. Usually it's not a big deal, but in some people it can be a challenge to use hyperbaric therapy, and you can cause trauma to the eardrum itself if you're not able to clear your ear as well.
So my understanding is that it's one of these systems that really needs to be carefully, first of all, choose what if they want to buy. If they don't want to buy, have a doctor or someone who really knows what they're doing with that person, because all these things, like, I mean, nobody asks when you're in these shows walking around and you book your session with one of the companies. Nobody asks if you have this or that or the other. You could easily have a seizure in one of the chambers, my understanding. You can buy the NanoV, you can buy whatever hydrogen water, you can buy red light therapy, infrared sauna, because none of them has a negative effect if you do every day, let's say. But if you have an obsessive personality and you buy a hyperbaric oxygen chamber, hard or mild, it's not a good idea to do it without knowing what you're doing. That's what I understood from this whole episode.
Yeah, and that's absolutely true. I think that you really should have some goals when you're going in to really understand what you're trying to accomplish. It's a time thing, right? You're spending a lot of time in a hyperbaric chamber. Hypothetically, 60 minutes, maybe as little as 30 minutes. If under certain protocols that I've developed over the years, you can get a good bump in energy with 30 minutes and then jump into a cold plunge or get into a cold shower. That's a really nice combination for people. But in general, you're spending your time in there, so you should spend it wisely. And I agree with you. I get concerned about people going into chambers at these conferences and not really knowing, what their medical history is. I mean, the good news is that these mild chambers, the 1.3 chambers, are very, very safe and very rarely have caused any issues in people, even with some of these things that I mentioned that could be dangerous. But especially if you're going to deeper pressures, it's really important you know why you're going in and that you're being supported throughout your time and that you have a good goal as to what you're trying to accomplish. If that's longevity and overall wellness, that's okay. But working with a provider to help you kind of understand that can be really, really transformative. And that's what's happened over the years with me, Ezra. Like I got involved in hyperbaric therapy because I was so tired, especially on the product side. I got so tired of like people coming to me 6 months, a year, 2 years later and telling me how they were using their chambers and just kind of like face palming it, like, oh my God, like this is what you've been doing. And no wonder why you don't feel good, or no wonder why you haven't seen the benefits that you've been hoping for, because unfortunately, a lot of these companies will give advice that if they give advice, they shouldn't be, number one, because they're companies, they're not providers. And oftentimes they're giving advice that's often very generic too. So it's not going to be personalized to you. And so like my framework is what I've really kind of honed over the last 10 years is like, it's a kind of a framework where I look at 6 or 7 different things along with hyperbaric therapy to truly optimize your experience. Like, what's your diet like? What's your lifestyle like? Behavior like? What are you going to do like before, during, after hyperbaric therapy in that capacity? What other technologies might be helpful? What other laboratory testing would be helpful to look at things like oxidative stress and energy metabolism and detoxification? And then what other practitioners might help you reach your goals, whatever those goals might be. And then looking at all that, then bringing it all together for patients, and then working with clinics all over the world to help them understand how they can integrate hyperbaric therapy into a larger context of the clinic that they already have. So if it's a biohacking clinic, you have lights, you have saunas, you have cold plunges, you have, exercise machines, like how to use hyperbaric therapy in the context of all that. Or if you're a chiropractor and you're doing adjustments and doing neurologic testing, how to use hyperbaric therapy in the context of all that. That's what I think is most powerful. And that's what, my team and I have been working very hard on, is not the technology, not the chambers themselves, but the software and the sensors that are going to power that technology. So you know how to integrate it with the other things that you're doing, that you understand your metrics and how they're affected by the technologies that you're using, and that you understand the metrics that are happening in real time with the technologies that you're using. What's your pressure? What's your oxygen? What's your time? So that you have all that information and you can make more informed decisions about how you're going to use the technologies together. So in essence,
the company that you have,
one base health. Yeah.
So it has an application, you said?
Yeah. So we have a phone application, educational software that we've been really working hard on developing. And in November this year, it's going to be launching. It's kind of its first major release with all the things that I just mentioned. But we're creating sensors that can go in various types of technologies, like your chamber, like your lights, like your sauna, so you can measure what's happening from those devices. But also we're creating sensors that can do that at the same time, integrating your wearable information into the app itself so that you can kind of bring all this data together and then create integrative programs with other technologies that you have at your house or have at your disposal, along with looking at all this data and seeing how it changes over time. Because in the end, anybody can sell a chamber, and I'm not really interested in that piece of it as much.
But obviously that's very visible, because he didn't say at all, like, if anyone would listen to this podcast, that they're like, I better don't buy one.
I think they're great technology.
No, but no, you were very honest. I don't think any hyperbaric people likes you at this point.
Look, I don't want to give the impression that I think it's a fantastic technology. But I think if you're going to buy one,
you just are telling the truth. I mean,
have I seen it help with so many different types of people? Absolutely. Strokes, traumatic brain injuries, mild cognitive impairment, even Alzheimer's dementia, surgical recovery, infection, chronic infection, longevity, regenerative medicine in combination with PRP, with stem cells, and the list goes on and on. Because the base physiology, decreasing inflammation, reversing low oxygen states, making stem cells release, immune system optimization, treating infection, it's pretty universal to healing, right? But again, it's context, right? In the sense of, if you're not doing anything else, then please don't go into a hyperbaric chamber, especially if it's a chronic issue. Do the other stuff first. The 80% of things that's going to help you over the long term. If it's an acute issue, though, all the things that I just mentioned, as far as doing all this integrated framework, none of it really matters that much. Really, if you just have an acute issue, you just need to get into a chamber, you're going to heal faster. That's the deal. But if you have a long-term issue, which is when most people come see me, then it's about this framework to really help people. And that's why we created One Base Health. That's why we created this platform that we're working on. And that's my clinical practice. If you're doing it that way, you're going to see a huge benefit, not only in a hyperbaric chamber, but also long-term as well when hyperbaric therapy is done. I guess I want to just make sure that I reiterate that I think it's a fantastic technology.
No. You said all these, but you were not encouraging people, hey, that's the only technology that would help you.
For sure, yeah.
And on your website, the One Base, you said, yeah? Yeah,
One Base Health,
there are great articles as well for people who wants to understand more what would a chamber do to the health, to sleep, diabetes, blood glucose level, etc.
Yeah.
That was a very enlightening session for me. One more time, I'm like, okay, Esra, you don't need to get everything you want because you probably would not need it. I'll be in Boulder in 3 weeks from now. So you said it helps with jet lag. You have your clinic. You have a chamber in there?
I don't have a clinic in Boulder. I have my own chamber in my house.
Okay.
There are some clinics around. I can refer you over if you're interested.
Yeah,
in
so
it a try.
Maybe it will help me for a couple of days to get in so that I don't...
Yeah, you could just, again, you can go to a mild unit just to get a couple days of hyperbaric therapy, just to kind of reoxygenate after your trip. I use a lot of methylene blue, as you probably know, with travel as well, because that's really great for preventing the stress that happens with travel, because methylene blue works just like oxygen and can help make energy. It decreases inflammation and it helps with energy production. So I use a lot of that. And then, so there's a couple of facilities in Boulder. There's a soft chamber facility. There's a hard chamber facility as well. But I really work as a consultant these days. So I consult with people, individuals all over the world that are interested in using hyperbaric therapy to help them heal, oftentimes, or sometimes to help them optimize and do the biohacking stacking thing too. Then I also work with clinics all over the world that are utilizing hyperbaric therapy in the context of a larger offering with other tools and technologies and practices too.
That's wonderful. So I'll see you in 3 weeks anyway in the conference or summit, Dragonfly, and we'll get a chance to chat more. Probably you'll guide me better with my crazy thoughts how to stack things.
Well, that's what I do for a living.
Thank you very much. I love having doctors like you, Dr. Yurt, and a couple of more that looking to different parts of my life. So it was wonderful to have this recording with you, and thank you for your time.
My pleasure. Thank you for having me.
I'll see you in 3 weeks, hopefully.
Sounds good.